In headache medicine, we deal with diagnoses that are highly gendered. Migraines more common in women, less common in men, cluster headache just the reverse. So based on that, physicians and I think patients have expectations of how likely it is that a man or a woman who presents with headache might have migraine. And in an interesting study from the United Kingdom in general practice, where patients first present in general practice with a complaint of headache, women do consult a bit more than men for headache. I think that's to be expected based on what we know about migraine being more common in women. But women who consult with a complaint of headache and migraine are more likely than men who present with the exact same complaint to be offered anti-migraine medications, reflecting, I think, one good thing, which is physicians are highly aware that migraine is common in women. But men with the same complaints are much more likely to be referred on for additional testing and investigation. And that's not necessarily so good for the men. If they have migraine, it doesn't really do them any good to be subjected to a lot of additional and probably unnecessary testing. And I think we all know that that can initiate a medical cascade that doesn't always end nicely for the patient. So clearly physician expectations about what is or isn't going to be the case based on patient sex influence diagnosis and treatment recommendations. We also know that physicians are more likely in female patients with headache to delve into possible psychological explanations for the headache and more likely to recommend psychological-based therapies to women. Again, some of those therapies can be very helpful, and certainly those kinds of things can play a role in how headache manifests itself. But probably the fact that they're more likely to do that reflects their beliefs and expectations about women compared with men, given the exact same medical presentation. It is important to move beyond just enumerating and discussing the problems. There are many of them. They're not in the past. But there are lots of actionable interventions. I focused in my talk on interventions at the level of the professional society, because we historically have thought that many of these things, addressing problems of sexual harassment, working on the leaky pipeline, helping women achieve academic promotion, we've thought of those as duties that fall to the institution or society at large. But professional societies are a microcosm of academic culture and medical practice, and they are also the arena in which women accrue many of the credentials and awards that they need to progress in their academic career. Leadership in an academic society, being the editor of a society journal, those are all things that help one get promoted. So if the atmosphere, if the climate in a professional society is not friendly and welcoming to women, if they are not encouraged to participate in leadership activities or sought out for leadership positions, then that's harmful to their career. And this has been recognized by the National Academy of Sciences, Engineering, and Medicine. They released a report late last year in 2018 that identified a number of barriers to having equal progression for women in their careers in medicine that looked in particular at sexual harassment. And they identified professional societies as important allies in the future to help combat some of this, and made a number of very specific recommendations about what academic and professional societies can do. And these include things like developing a code of conduct that specifically outlines expectations of behavior and comments specifically on behavior that could be considered sexual harassment or bullying of women. They suggest that the climate at professional meetings should be made more friendly to women, all kinds of other things, and these are actionable interventions. Beyond that, there are things every single one of us can do in our daily life. I have spoken, for example, about what we call micro inequities, the little offhand comments that women are subjected to over and over again, often daily for many years, that nobody really means to be harmful, but that cumulatively can have an impact on their perception of themselves and their competence. So those are called micro inequities, but there also are micro affirmations, and these can be applied, I think, very usefully to everybody, not just the women that we work with. Things like making making certain to say, you know, you gave a really great talk, or you did a wonderful job on that, or there's this important meeting coming up, I think you should go. All kinds of things that can be helpful to a woman or anybody, actually, and signal to them that you believe in them, you think they're capable of advancing, you see them as a competent person.